Hey, I'm Maddie from Milestone Photography. I run a birth and newborn photography business here in Wellington, New Zealand. Don't miss the opportunity to preserve the most beautiful and profound moments of your life. I'm here to make sure that you never forget the incredible journey of bringing your babe into this world. So if you're interested, head to the link in the description, milestonephotography.co.nz, or check out my page on social media, Milestone Photography NZ. Let's get into it. Today we're going to be talking about perineal massage. I'm going to be giving you a comprehensive guide and demonstration of how to perform perineal massage. In today's video, we will talk about why perineal massage is an effective tool leading up to your birth and labour. We'll talk about how to identify where your perineum is. And as I said before, I'm going to give you a comprehensive demonstration of how to perform perineal massage. First things first, it's really important that you know where your perineum is. If you don't know where your perineum is, then perineal massage is not going to be effective. Here in this diagram, there is an image of a vagina, looking at a vagina of someone who would be laying down, and you'll be looking at them up through their leg. The perineum is the skin between your vagina opening and your anus. Not only is it the skin in between your vagina opening and your anus, it is also internally a group of muscles or muscular tissue that hold together and support your pelvic floor. So now that we know where the perineum is, I want to tell you why perineal massage is important and an effective tool for leading into your labour and birth. As your baby descends down into your cervix, there's a significant amount of downward force. That downward force and pressure is applied to our perineum. Now, if you can picture this scenario, you understand why you would want your perineum to have some elasticity and flexibility. As your baby moves down into your birth canal through your cervix, you want the downward pressure that is being applied to your perineum to be able to stretch that perineum. Often we hear physiotherapists, midwives, doctors speak about our pelvic floor. There's a lot on social media surrounding our pelvic floor and how we must prepare our pelvic floor for birth. And that's absolutely true. We should be preparing our pelvic floor for birth, but our perineum is just as important. As mentioned before, our perineum is a skin between our vagina and our anus. That skin is most susceptible to tearing during birth. Yes, I said it, tearing. I know we all fear it. Tearing during birth is not something that anybody wants to go through. So, how does perineal massage come into it? That's a great question. By gently massaging our perineum, we are stretching and creating elasticity within our skin tissue on our perineum. The more you practice perineal massage, the more elasticity you are going to create in your perineum, allowing it to easily stretch or be flexible as your baby's head begins to crown during birth. Now let's get into the bit that I know you've all been waiting for, the demonstration of how to perform perineal massage. Today I have a Play-Doh model that I've made to demonstrate how to perform the perineal massage. Just remember, if you're doing this for the first time, you can feel tense, and it's important to take it slow, to embrace your touch and to get familiar with your vagina. It's completely normal for your body to respond with tension when touching the vagina. Perineal massage will help to ease that tension, and that's another benefit for birth. First things first, wash those hands. We don't want any nasty infections, especially when you are pregnant. Second, we need to find a position that is going to work to accommodate this big bump or growing bump. This is often the part that makes perineal massage hard to do. I suggest finding something strong that you can lean up against, like your bed, a wall, or a couch or a chair, just something that you can brace up against and use that forward force to help reach down to your vagina. Remember, this is all a matter of trial and error. It's all about responding to what your body tells you. Never should anything be hurting during this process. Another thing to consider before you start is what sort of lubricant you're going to use. You may have a lubricant already at home that you've used before. Just check what is in the ingredients and maybe touch base with your midwife, double checking that this lubricant is safe to use during your pregnancy. Otherwise, I would recommend a natural oil. I would recommend a range of neutral natural oils. There is a list of those oils in the downloadable guide that is linked below in the description. Before we start, take in a couple of deep breaths, in through your nose, out through your mouth. Allow your breath to relax you. So here is our Play-Doh vagina. This area here is the perineum. This is the anus. Here's our vagina opening, our urethra, and our clitoris. Okay, our labia. So this is the part that we're going to be massaging. For the sake of this video, I'm going to turn this model around because this isn't the way that we would be massaging our own vagina. It would be the other way around. So after you've taken those deep breaths and you're feeling relaxed, I want you to place your forefingers on your perineum and your thumbs on the opening of your vagina. You're going to gently insert your thumbs into the vagina opening, and you're going to start by stretching that skin. Now how you're going to do that is you're going to press down on your vagina opening, down this way, towards your anus. Put pressure on that perineum. You should feel a gentle stretching sensation. If at any time it hurts, please stop or adjust your pressure. You'll need to hold the stretch for 1 to 2 minutes to be effective. The next part of the perineal massage is to create a motion, a U-shape motion with your thumbs. So now the next part of the massage is to massage the area between your thumb and fingers in an upward and outward motion, creating a U shape. You're going to create this U shape from top to bottom, bottom to top. You're going to repeat this movement for 3 to 4 minutes. Make sure you maintain a gentle and controlled pressure. This will help improve flexibility and blood flow to the perineum. So again, in the vagina opening, you are going to create a U shape going down towards the anus and then meeting where the vagina opening finishes. There you apply a pressure and then work your way back up the sides of your vagina opening and back down, repeating this U shape for 3 to 4 minutes. You want to repeat this process twice a day from around 34 weeks. Remember, consistency is key to reaping the benefits of perineal massage. If you're having trouble finding a comfortable position to perform the perineal massage, consider asking your partner to help you. Perineal massage is not recommended when you are experiencing high blood pressure, placenta previa, or a vaginal infection such as thrush or herpes. Remember to talk to your midwife. Your midwife is there for your care. Send them a text if you're not sure about anything and ask them specific. That's it for today's demonstration and chat. I hope you've enjoyed it. Please don't forget to check out the downloadable guide that will give you more specifics, lots of visuals and references for where to buy oils if you don't already have them at home. If you have any health concerns or questions about perineal massage, please reach out to your midwife. Thanks for watching and best of luck on your pregnancy journey.